In 1981, the first cases of HIV were reported. This was 41 years ago, and since then there has been a global response to the disease. No longer a pandemic, it continues to be a challenge for many countries. While efforts and science have improved the outcome and impact of the illness on the individual and a society, there is still no cure, and persons are still infected and affected by this. Joining us to speak further on the HIV endemic and national response as we commemorate World AIDS Day tomorrow are Dr. Matthias Ofre, National AIDS Coordinator, and Mrs. Lucine Vaughn, Health Educator and Counselor in the National AIDS Program. Welcome to Good Morning SKN.
Welcome,
always a pleasure
guys.
to see you both.
Good morning.
All right, so since 1988, there has been a global thrust toward reminding people that HIV is still with us. This year, World AIDS Day is commemorated under the theme Equalize. This theme is meant to engage in meaningful strategies to eliminate the injustices that impede the fight to end AIDS, according to UNAIDS. How is the ministry working towards this?
It has been a slow but rigorous process, and with the passion and drive we have to really combat this epidemic that it is now, we are ensuring that we have people informed and educated about what it is and how we are to prevent being infected, and which will mitigate the spread of the infection. And working with the program based on the vision that the World Health Organization have of ending AIDS in 2030. So we are ensuring that we have a lot of persons tested, a lot of people informed, and ensuring that provision to medication, accessibility to health checks are made available.
That goal is still a realistic one, 2030?
2030, we're hoping that we can get it eradicated by 2030.
So what if it's not eradicated by 2030?
We go until it's done.
Okay.
And that depends on you and me. We all have to do our part.
It's a continuous process to ensure that we achieve a goal. It's always good to aim high and miss, that to aim low and hit.
So the goal is ambitious in itself then?
It is.
Okay.
And remembering that HIV and AIDS is everybody's business. So the Ministry of Health cannot do it alone. It needs everybody. The churches, the schools, the workplaces, the community, the organizations, and it boils down to the individual. So yes.
And actually, it's a holistic view, a holistic approach where we have a multi-sectoral approach towards it. Every sector, every establishment are involved. We try to incorporate and partner with everybody to ensure that we fight this, because just one view, one dimension cannot really eradicate the problem.
All right, just a follow-up question, if I may, because realizing that, we had the first case of HIV in 1981, that's a generation. I'm 40 years old. I was born in 1982. This has always been with me. I'm not HIV positive, but I'm just saying.
I love that disclaimer.
And for what if he is?
Well, that's also the other point. But, well, in our society, we'll get to that, stigma discrimination, I guess, a little later. But when it comes to that, is it such that you find that people are desensitized to it? Because there's an entire generation who've grown up with this disease. Do you think that people think, it's not that big a deal anymore? And that could be part of the problem?
Yes, I think from the beginning, due to the fact that just like COVID-19, lack of information, people not really being informed about what the problem is, so what this virus is. In relation to HIV, people are not really informed. So it was still an experimental hypothesis on what the problem was. But at this point, people are informed. And there are a lot of millions of information, research that have been done on HIV that anybody can just type and just get in a lot of information, to really educate themselves enough to know what the problem, what the virus is about, how it can be transmitted. So with this information, I feel like people only act ignorantly based on lack of information. So people being informed, know what the problem is, and it's easy for us to know that it's not actually a big deal. When I say it's not a big deal in a sense, I am saying that it is not more of a death sentence anymore. We have people living with HIV for years and years, and see even some of them even healthier than those that are not infected, because they take their health very serious and ensure that they take their medication, exercise, and be safe while making involving any sexual practice.
You say that. I will ask Lucine this question. Was it a death sentence? So because when we're not fully educated on things, we normally say, oh, you're going to die from it. But was it an initial death sentence?
Yes, yes.
Oh, it was? Okay.
Prior to the treatment,
Okay.
antiretroviral therapy.
Okay.
But now, thank God, we have the treatment, and that could reduce your viral load and make it almost undetectable. And then undetectable equals untransmissible. So when your viral load is that low, it is virtually impossible to pass on. So we have treatment now, and treatment is available. It's free of cost. The test is free, and it's just left up to individuals to access it. And as a doctor says, the more information persons have, it should cause them to act on it. But I find that we have become very irresponsible, and we leave our sexual health into our partner's hands, into somebody's hands. It's somebody's fault, and once my partner doesn't have it, then I'm good. So it needs to come down to personal responsibility.
That's definitely a lottery that I don't want to play. You know, I think you're saying another way to say it is that we're gambling if we're not taking accountability for our health in that way. Doctor, I'm going to go back to the 2030 global target. There's a ratio I'm seeing here, or at least three figures, 90, 90, 90. What can you tell us about that? What does that mean?
Basically, we want to ensure that people are, in summary, people are well informed about what their status are, and people are those that are infected are under treatment, and those that we also want to ensure that the viral load are extremely low, in that it's not transmittable to other persons. As such, we have a hold on the problem, because if it's not transmittable, it will eventually die off.
But I am concerned about folks that get the all clear and then they just go back to having sex without any form of protection. How do we deal with something like that?
The all clear meaning that you are negative?
Basically, yeah, after you would have had the virus.
Once you would have gone through the process, the counseling tells you that you are negative for now. And at that point, we are not even sure if you are negative, meaning that there is a window period.
Yes.
So, and which takes 3 to 6 months for the test to actually pick up that. Now, during that period, then you are kind of negative for now until you would have come back 3 months.
So you could be false negative.
To ensure, yes. And then after that, we said that that is just for you. So there is never an all clear. You are to continue using protection.
Yeah, and it also, you know, in addition to that, knowing that the body produces an antibody that could aid to detect whether you're positive or negative, and that 3 to 6 months is the window period, and it's very essential. Even if you have a drastic reduction in viral load, we still encourage. That's why we ensure that we have a case manager. That any issue that has to do with them, we connect them to the person, and also have counselor. She's indicated that we always continue to reach out to them, let them know, hey, listen, you still have to ensure to abide by certain rules to ensure that you are healthy and your partner is healthy and the society is healthy. That's why we actually establish or roll out a program we call Safe Sheet, Safe Street. In other words, if the bedroom is safe, the streets will be safe. So if we practice safe activities home, our streets for sure will be safe.
And then you ask after having the all clear if you must go. So if you are negative, we still need to put things in place to stay negative. So it's not that I'm good, so I can go.
Yes.
And then you won't be taking your medication too.
Then you know that you are no longer negative.
Okay.
All right. Well, one of the things that comes to my mind is after we were going through the pandemic, while we were going through it, this whole process of contact tracing was a thing. If you were potentially, infected, we listed your contacts, we did all of that. In relation to discretion and also needing to curb the spread of HIV and AIDS, Is contact tracing done? Is it discreet? What can be done if, for instance, I don't know that you can do anything. If I'm listed as a potential contact and then I say, but you know, Lucine was the one who was contacted, you know, how do we deal with those sorts of things?
So when one is tested HIV positive and they list their contacts, then the counselor contacts that person.
Is that mandatory, the listing?
Yes.
Oh, wow.
And then we say that we have reason to believe that you would have been exposed to the virus. And then you are tested, no name, so I don't tell you that your partner came in, and it's not like that. In the event that there is some fear still, then we would discreetly find that person, and we might go in the same church in which they're in. We go by the workplace.
I don't want to see you in my church.
It's all about lane strategy.
Yes, but we have to try and get you into treatment so that you can have the best life possible.
Strategic approach to really achieving it without while ensuring that the person is confidential, as in this process confidential, and the person is safe. Because one of the problems why people feel like they can't go testing or access the health services provided is because of the sense of confidentiality, and that is major concern for me, you know, as a program director, or for us as a program director, and also at the Ministry of Health for the program to ensure that everybody you're safe. I can have 10 persons come to test. I don't even know their name.
Yes.
Basically, and even with the record, your name is not documented.
Yes.
In the record to ensure that you are safe.
Yes.
20 persons can even see the paper, will not even understand what exactly it is.
Yeah.
And that's how we have rigorously put that strategy to ensure that people are safe, people are confidential,
Yes,
and the persons that work directly with us to provide the test and all of the services we provide are well trained, and also ensure that they sign the oath of confidentiality.
Okay, good stuff. During the break, we were having a conversation, and you were mentioning the time that one should be concerned about contracting the virus. Can you let our viewers know in the nicest Lucine way?
No, I was saying that when people come in for testing, that they are usually so nervous and scared to come in to me, and I usually say, no, it's not the time. The time to be scared is when the clothes are off and you don't have any form of protection, and that should prompt you to go and get your condom. Because by the time you reach me, lay down on your face. I'm just here to help you. But you have to help yourself there before you reach me.
Yes. Oh, wow.
Prevention, as the old people would say, an ounce of prevention is better than a
Cure.
pound of cure.
Yeah.
And we were talking about that, Dr. Ofre, we were talking about the fact that the numbers increased during the pandemic. Is that?
Yes, due to the fact that, you know, with lockdown and also the more fear of one virus, which is coronavirus, we neglect not neglect, but unfortunately, we couldn't do much in terms of informing and also providing. We're not really available for persons to really provide. People can't even access health system because of the lockdown and everything.
Yes.
So that actually led to a little increase in this the virus, you know, spreading. And also after the lockdown, people just went rampant, of course, you know. So that also led to an increase. So now we are actually ensuring them to understand, and people to understand that, you know, it is more of ensuring that you get yourself tested. Because the problem is not HIV, the problem is AIDS. You know, HIV can, if you are infected with HIV, you can get treated and then the viral will come extremely low.
Yes.
AIDS, it has moved to a stage where you are now open to opportunistic diseases. And
Yes.
then your immune system is so weak that can't
Yes.
fight any common infection that it would normally fight. You understand? So that's where we don't want you to progress to. So it's early detected, easily resolved, or handled or managed, than when you get to a point where we have to be fighting rigorously to ensure that we keep you alive.
I'm generally not afraid of police officers, but for some reason, Lucine, you're making me very, very afraid.
Oh, wow.
Explain to us the importance of your costume.
Okay, my costume, I am not here to find you, F-I-N-U. I'm here to find you. So I am the sex police. And as you know that it's licensing time, nobody should be on that road without having their license. And that license is simply your status. Nobody should be engaging in sex unless you know your status.
Yes.
And so I am here to let you know that you can have your status in just doing a quickie. What you said that?
Just a 15 minutes.
You like quickie?
Just a 15 minutes.
Yes,
Why?
it's just that test. Quick.
Yes.
15 minutes and you have your status. So World AIDS Day is tomorrow, and then you
Yes.
have a whole month where you can find me and find us. And we would be in the square on the 15th, but I
Oh,
guess
good
that
stuff.
you would accept.
Can't
but
miss you.
Yes, and ensuring that after you would have gotten your license, then that is not an all clear to go and drive recklessly. You still have to
Exactly.
put on your
Seatbelt.
sheet belt, your protection.
She kills me.
Yes, and ensure that your partner has his or her license too, because one person can't know their status. That's no good. You know yours, you have your license, and that opens up for conversation. So this is mine, where's yours? And so we says, no license, no ride, no drive. So
No drive, yes,
same.
because you
Either
can't
one,
drive
that
without a
works.
license.
That's
Oh,
fine.
yes,
Either
oh, yeah,
one
yes.
works. Either one works.
motorbike.
So Lucine, you mentioned the testing on December 15th. What time? You said the Independence Square.
Yes, and we will be there from 9 a.m. to 5 p.m.
Okay. Good
all
stuff.
day.
And on the first, which is tomorrow, we have condom distribution day.
Okay.
So we'll be at the square as well. Come and get your condoms. And we want to make that day, a national condom day. So any sexual activity that will be involved or be carried out should at least commemorate the use of condom and the effect of, the use of condom. What we are actually promoting, what we're actually preaching, and to actually mitigate the spread of the virus. So come from 9 a.m. we'll be there, distributing condoms. So just pass by and grab some, and it's important. And also in health centers, you can do your test and also take the prevention commodities like condoms and lubricants. There in the health centers, in all health centers, you can also come by the Ministry of Health at the National Secretariat, and you can have it for free.
Okay.
All for free.
And
you can test it too.
And that day, we would like everybody to wear red.
Okay,
As
good
we
stuff.
usually say, red up the town. And you know that our symbol is the red ribbon.
Yes.
And when you see red usually stands for what?
Danger.
Danger. So you have to look before you leave, get your test, and make sure that you have your protective gear. But red is also for passion. And so we want you to have that passion to get the virus out the town, as we say, doctor, get rid of them.
Get rid of the virus.
And that's all the STIs, okay?
Oh, yes.
And red also means stop, that's stop red. Even if you are already in the process of engaging and you remember my costume, then don't be afraid, stop.
I'm never going to look at an orange light the same way. I'm going to be waiting for red.
Stop before you get in an accident.
Indeed, indeed.
You're gonna hurt yourself.
Indeed.
Like I said, never going to be the same, Lucine. All right. The World AIDS Day activities, they span the entire month of November. What can you tell us about those?
Actually, we have numerous activities we have planned and actually ongoing right now. We've been reaching out to schools, school sensitization, where we inform the young people about what HIV is and what World AIDS is about and how to prevent it. Based on their age, we provide information based on their age, and also will be, in fact, after we actually will be in CFBC, this afternoon, actually informing them about what HIV is and how to prevent, knowing that they are almost at the age of, consent, 16 consent, and most of them can access health services until they're 18. So we want to ensure that the primary aspect is taken care of, them being informed well to make well-informed decisions about their health. So we've been going around doing that, informing, talking to the schools and also the students and also the teachers as well. We will be having outreach on the 15th, which is the National Testing Day. So we also encourage the people to come out and get tested. There will be giveaways as well. And we also have different outreach awareness, HIV awareness in different social media platforms, as well as radio stations and so on and so forth. Church, we also, that's what we say, we're having a holistic view. So all the churches, we're encouraging, partnering with the Christian body to actually communicate or teach or preach about, safety. About, so we have a message that have been sent to the churches that they can actually communicate about the members. And we also advise and also encourage them to talk about stigma and discrimination, because, God wants us to love everyone, without discriminating who we should love more or what love less. So it's important that we showcase that in every aspect of our lives, because that's what He really wants from us all.
Indeed.
Yes. Yes, we actually partner with Canepa. This is the youth parliament. In fact, I was there. I was so mesmerized by their effort. It was just amazing that we have smart, hardworking, researchful, young individual. I'm telling you, our future is bright. This country, our future is bright. I was really, really happy to be there and also to hear that the concern on age of consent, why the debate, which they should bring the law to either 16 to be able to, have access to sex and also access to health services, or we take it to 18, where it was, and have it in all together. It was an amazing debate, and trust me, I look forward to working more with them, and to ensure that we achieve greatness.
Lucine?
You went a little fast with that, and I just wanted to emphasize that presently one can have sex at 16 because that is the age of consent, but you cannot be tested or have access to condoms until you're 18. And so that is why.
So how can there be something where I can do it?
But you can protect yourself.
It's no man's land.
Yes, and that's what the debate's about. Because if you say, okay, you're 16, you can start having sex, but you can't go ask for condom. You can't go on your own to get tested.
Ludicrous.
So it is actually, we're actually fighting ourselves to really achieve it, counter-reacting. So the vision, the vision is to be proactive than reactive. Because if they start having sex at 16 and then they're exposed to HIV at 16, before they being tested at 18, it has progressed to 8 already. You understand? So that's why we are working on ensuring that we work with the young people, work with the laws of the land, work with the government to ensure that we come to a census where we get everybody protected. Because if our nation is safe, if the health of the nation is safe, the people are safe, our future is really secure.